Hi, we're group four. We're doing type 1 and 2 diabetes. Our group members are Nidhi Patel, Patricia Koh, Amy Tran, Benjamin Vargas, and Mariah Rodriguez.
Type 1 diabetes is an autoimmune reaction. It cannot be prevented or cured. This is when the body does not create enough insulin. The causes are unknown, but genetics may play a role. Type 2 diabetes can be prevented through lifestyle modifications, and this is when the body cannot create enough insulin or develops insulin resistance. The causes include genetics, aging, inactivity, obesity, and more.
Diabetes affects people of all age groups, races, and genders. Type 1 is most prevalent among children and teens, while type 2 is most prevalent in those 45 and older. Type 1 and 2 are differentiated by age, but in recent years, both have become more common in children, teens, and young adults. Type 1 and 2 are present in all geographic regions and do not seem to be affected by gender. They do, however, have a heavy presence among American Indian, Black non-Hispanic, and Hispanic communities. Type 1 is associated mainly with genetic factors observed through family history, and type 2 is exacerbated by poor dietary and lifestyle choices. Some type 2 risk factors are being overweight, over 45, non-alcoholic liver disease, and being physically inactive.
In the healthcare community, there are 1,400 community health centers that provide to over 29 million patients in over 12,000 clinical sites. And La Maestra is an example of a community health center located in San Diego. At the national level, there are organizations that influence diabetes policies in CHCs. These include Health Research and Service Administration Bureau of Primary Health and the National Association of Community Health Centers.
Screening for diabetes can vary between about 4 different options. There's an A1C test measuring average blood sugar levels over a 2 to 3 month time period, a fasting blood sugar test that measures blood sugar levels after an overnight fast, a glucose tolerance test measuring blood sugar levels 1 to 3 hours after drinking a liquid containing glucose after a night of fasting. Lastly, there's a random blood sugar test that measures your blood sugar levels at any point where you feel you need to be tested. In regards of treatments, there are options of implementing healthier eating habits, increasing physical activity, and insulin therapy. And in some severe cases, surgeries have also been an option. We do have CHCs that provide care that is affordable and accessible to those who are most vulnerable to diabetes, providing a sense of urgency for the patients, allowing them to feel seen and heard. Some ways that CHCs support them are by including coverage requirements, quality reporting and incentives, prescription discounts, healthy behavior incentives, and team-based care.
Nonprofits and government organizations such as the American Diabetes Association, National Institute of Diabetes and Digestive and Kidney Disease, as well as the Center for Disease Control, have websites where you can find information about diagnosis, treatment, and prevention of diabetes. Those that suspect they may have diabetes or have already received a diagnosis, your primary care doctor will be your best resource in treating and managing your diabetes. They will be able to set you up with treatment and regular screening to track the progression of your diabetes. They may also recommend you see a specialist if deemed necessary. Being overweight is a risk factor, but you can still be a diabetic even if you are a healthy weight. Diabetics don't need to eat special foods. A healthy diet for a diabetic is also a healthy diet for a non-diabetic. Diabetes is a serious disease, claiming the lives of more people each year than AIDS and breast cancer combined, in addition to increasing the risk of having a heart attack. Healthcare professionals can help fight these misconceptions by educating their patients on the truth about diabetes and providing them with the resources needed to help manage their disease.